Hello everyone and welcome to my channel and another video in our clinical pharmacy course. In today's video, I'm going to talk to you about the basics of critical care clinical pharmacy. Now this is a topic dedicated to clinical pharmacists who are interested in joining the critical care system, those who are willing to work in an intensive care unit or a high acuity unit, whatever you name it. There are so many names out there. So yeah, this video should be hopefully useful to you, give you a lot of information about the basics that you need to know before practicing there. Now, a lot of pharmacists try to avoid critical care areas because of these areas are really harsh for many people, and they just cannot practice such a really fast-paced, highly critical area. But I know a lot of people who still love to practice critical care, and they find their passion there. And this video is basically dedicated to those people. Now, critical care pharmacy, as you all may know, is a specialized area, and it's not a simple, easy specialty. It requires a lot of work to become a specialized in critical care, and it focuses on the care of critically ill patients. Now, before we dive more into that, there's a lot that we're going to learn today. If you haven't yet subscribed to the channel, this is the time to do that. This channel is dedicated to clinical pharmacy and clinical pharmacy practice. I teach you how to become a clinical pharmacist, and we have our clinical pharmacy course as well on our website. If you're interested to join in, with over 17,000 students out there who joined the course and are now practicing as clinical pharmacists. So make sure to subscribe to the channel, activate the bell so that you get notified of future videos, and let's keep going with today's video. Now, critically ill patients often get admitted to an ICU unit, which is the intensive care unit. It can be named something else in different countries, like high acuity unit. There's also a cardiac intensive care unit, or a surgical intensive care unit, or a neurology intensive care unit. There are several different types of ICUs out there. Whatever you name it, those patients are called critically ill patients. They require complex and meticulous medical attention due to severe life-threatening conditions that they are going through. Now, clinical pharmacists in this field play a crucial role in optimizing pharmacotherapy. They ensure medication safety, improve patient outcomes. They have a lot of things that they do, and they need you to do in such areas. Um, Now, the first thing I want to talk about is the role of clinical pharmacists in critical care. Um, of course, clinical pharmacists are integral members of the critical care system. They work in a multi-disciplinary healthcare team alongside physicians, nurses, RTs, that's respiratory therapists, and other healthcare professionals such as dietitians, and mostly the clinical pharmacists are responsible for a few things. Number one is medication management. Now, critical care pharmacists have to ensure the appropriate selection, um, dosing, and administration of medications. They review medication regimens for drug interactions, contraindications, and appropriate use, and tailor therapy to individual patient needs. Now, this is no different from practicing clinical pharmacy in other areas as well. You do medication management anywhere at the hospital, not just in ICU, but it is a crucial task that clinical pharmacists take care of. The other role that clinical pharmacists are needed for in a critical care area is therapeutic drug monitoring. Now, again, this is not new. We do that in every where around the hospital, given the narrow therapeutic index of many medications out there. pharmacists or clinical pharmacists have to monitor drug levels and adjust doses to maintain efficacy and minimize or prevent toxicity, of course. And a good example about that is vancomycin. Another role for clinical pharmacists in critical care areas is adverse drug reaction management. Now, pharmacists identify, manage, and prevent adverse drug reactions, which are commonly seen in critically ill patients, and that's mostly because there's polypharmacy involved in this, and also due to the altered pharmacokinetics of those patients, critically ill patients. Clinical pharmacists also play a crucial role in education and training. They provide education to healthcare staff on new medications, protocols, and best practices. They also counsel patients and their families about medication regimens and potential side effects. Take an example, a patient who enters the cardiac intensive care unit with myocardial infarction, a STEMI or an NSTEMI, and now they're discharged on all these medications that are new to the patient. You have to sit with the patient, counsel them on the importance of these medications and the importance of compliance. The patient has to be compliant with these medications for the long term, and how these medications can actually save their lives. You can also, or you should also, talk to the patient about the adverse effects of medications, what to expect, and how to report them, where to go if they experienced an adverse drug reaction, especially if it's a new medication for that patient. Another role for a clinical pharmacist in the intensive care unit is protocol and guideline development. We get asked a lot as clinical pharmacists to contribute to the creation and implementation of clinical protocols and guidelines to standardize and improve care practices within the ICU. So it's not weird to see that someone is asking you, the head of ICU or the head of nursing, to put down a protocol to facilitate the administration of, for example, heparin or heparin infusion or something similar. Or yeah, so they really love to work with clinical pharmacists and know that you know more about medications and protocols and guidelines. So they will come to you for help when it comes to protocols and guideline development. Last but not least, clinical pharmacists in an ICU unit contributes to research and quality improvement. We basically engage in clinical research and quality improvement projects, help advance the field of critical care, and of course, enhance patient outcomes. Now, the next thing I would love to talk to you about is the pharmacotherapy of critically ill patients. Now, those patients have a really complex pharmacotherapy, and that's due to the unique physiological changes these patients experience, and that's specific for critically ill patients. An example of that is the altered pharmacokinetics and pharmacodynamics. When we look at the absorption, for example, drug absorption can be unpredictable in critically ill patients, and that's due to factors such as shock, GI dysfunction, and maybe the use of vasopressors, which we use a lot in the ICU unit. Also, when you take a look at the distribution of drugs, you'll see that the distribution of drugs is affected by changes in body fluid compartments, protein binding, and capillary permeability. Another factor that get altered is metabolism. Now, looking at the liver function, you might find that most of these patients have impaired liver function, and which affects drug metabolism, of course. Um, and that's one of the reasons why we keep an eye and monitor liver function tests for all critically ill patients on a daily basis. And finally, when you look at excretion, even that is altered, and renal function is often compromised in those patients, which necessitates careful adjustment of drug doses based on renal clearance. And I'm going to show you an example in a minute that we do. We calculate the creatinine clearance and sometimes the EGFR on a daily basis to make sure um, that the medications are dosed based on these levels. Now, when you cover the ICU unit, whatever it is, whichever it is, you need to pay close attention to the pharmacotherapy of those patients. Now, pharmacotherapy must be tailored to each patient, taking into account their unique clinical status, comorbidities, and concurrent medications. Of course, you need to look at the drug-drug interactions, drug-disease interactions, and there is no one better than a critical care clinical pharmacist to do that. Um, the dynamic nature of critical care requires clinical pharmacists to be adaptable, making swift changes to drug therapy in response to patients' evolving condition. And that's one of the reasons what makes the ICU or critical care area a very fast-paced and makes or scares all clinical pharmacists from practicing in such an area, because someone might not be as fast as they should, and may not be able to cover a critical care area in that case. You need to be very quick, very fast in response. Keep a close eye on all medications, and do your calculations on a daily basis, which could be exhausting for some people. Now, there are some common pharmacotherapeutic challenges in critical care. Um, Managing medications in a critically ill patient involves navigating several challenges. One of them is polypharmacy. These patients, the critically ill patients, often receive multiple medications simultaneously, increasing the risk of interactions and also adverse drug reactions. Now, clinical pharmacists must carefully review and manage these regimens and try to eliminate anything that you don't need anymore for that patient. Another challenge is the organ dysfunction. Liver and kidney dysfunction is very common, necessitating frequent adjustments of drug dosages and also closely monitoring the drug levels in certain cases. Another challenge is infections and antimicrobial stewardship. Now, infections are a leading cause of morbidity and mortality in ICUs, and clinical pharmacists really play a key role in selecting appropriate antimicrobial therapy, dose adjustments based on organ function, and also preventing antimicrobial resistance. Another challenge that you'll see in an ICU unit is sedation and pain management. Now, balancing the need for sedation and analgesia while minimizing side effects and preventing dependence in the ICU is a critical aspect of care. And we've all heard about analogous sedation being preferred over using both sedative and pain management. And we're going to talk about that in another lecture in the future. But yeah, optimizing sedation and pain management is always a challenge in the ICU unit. Last but not least, a very important challenge in the ICU is nutritional support. Ensuring appropriate nutritional support, whether enteral or parenteral, and managing drug nutrient interactions is another important responsibility. Now, a lot of medications out there may interact with enteral feeds, and we sometimes need to hold the enteral feeding for 1 to 2 hours before and after giving a medication, just to minimize these interactions. And that's one tip that we do to minimize interaction with enteral feeds. Another tip is if the medication is available in an injectable form, we just give it as an injection. So we have to convert from an oral to injection. And then in the future, when the patient stabilizes, we can convert them back to oral formulation. But yeah, Try to keep an eye on nutritional support. The dietitian will always approach the clinical pharmacist to check if they did a good calculation in terms of nutrition, and ask clinical pharmacists to review their calculations and make any changes if appropriate. They need to be good at calculating the nutritional needs. Now, I want to give you an example of a patient that entered the ICU and how the clinical pharmacist dealt with that patient or deals with that patient on a daily basis. And a very good example would be, or I should say, a very common example is sepsis, a patient entering or being referred to the ICU for the management of sepsis. Now, sepsis is a life-threatening condition, and we see that a lot in the ICU environments. um, the management of sepsis, there are guidelines for the management of sepsis set by the Society of Critical Care Medicine. So what happens? We receive a call that a patient with sepsis is coming to the ICU, being referred by the emergency department physician. Immediately, um, the intensivist and the pharmacist, the clinical pharmacist, will identify the degree of sepsis, do their calculations, um, um, obtain blood cultures and cultures from any other area of the body that may be necessary, like urine cultures, skin cultures, if there are some wounds or open wounds, and then start antibiotic administration within 1 hour of presentation. We're using a broad spectrum combination of antibiotics, adjusting the doses, ordering laboratory tests to assess kidney function, liver function, and everything else, CBCs, and monitor the patient. Of course, on a daily basis, we're going to have to monitor and adjust therapy based on the kidney and liver function of the patient, provide fluids, massive amounts of fluids at the beginning, fluid resuscitation, provide or make recommendations for a vasopressor if the mean arterial pressure is low, and that's to support the organ supply of blood and oxygen. Look at any adverse effects caused by medications. If you don't have a history of allergy, keep an eye on the patient. They may develop an allergy to any of the medications we're using, especially the antibiotics. If they have a history of allergy, try to use something that they don't have an allergy to. And then look at the source of infection. Try to brainstorm with the intensivist what could have caused the sepsis, because that's a life-threatening condition. We need to identify the source in order to facilitate treatment. Now, all of that happens at once, and then on a daily basis, we reassess the patient and see if we need to add any medication or make any changes to the pharmacotherapeutic plan. Now, when reviewing such patients in the ICU as a clinical pharmacist, you need to look at certain basics, like, for example, is the patient on stress ulcer prophylaxis or not? Do they need one? Is the patient on DVT prophylaxis or not? Because they're going to be bedridden for sure. Do they need something for, you need to assess if there's any degree of delirium at this point, if there's an infection ongoing for a while now. Do we need to prevent delirium or treat delirium? Do they need something for that? And then later on in the treatment, are they responding to the antibiotics or not? Do we need to add steroids? Do we need to add an antifungal? It all depends on the patient case and the source, identifying the source of infection, of course, in those patients. Um, there's so many assessments that we do on a daily basis. Looking at the labs and assessing the patient clinically is very important, and clinical pharmacists really collaborate with doctors and nurses in optimizing the patient outcomes and therapeutic plan. I think that's all I have for today's lecture. Let me know in the comments if you have any questions. We're going to have a lot of lectures on intensive care and critical care medicine. So if you have any specific topic that you want me to talk about, let me know in the comments, and I'll be more than happy to create I'll lecture about that. Thanks a lot for watching today's video, and I'll see you in the next one.